name is OOsuntoyinbo. Sorry, fixing my seat. And this is my Module 1 assignment for my teaching strategies in nursing education class. So to answer question number 1, I'm going to describe how the behaviors, cognitive, social learning, psychodynamic, and humanist theories can be used to increase or decrease a behavior. So the behaviorist theory argues that behaviors learn through interaction with the environment, and it focuses on observable behavior to change behavior, not internal processes, which it states that observable behavior is what drives behavior change. It also argues that positive or negative reinforcement and punishment are the best ways to change a behavior. Positive reinforcement increases a desired behavior, and negative does the opposite. Next, we have the cognitive theory, which argues that thoughts, beliefs, and problem-solving processes influence behavior. It emphasizes the role of perception, attention, and memory in learning. So if we're going to use this theory, we would teach a patient positive self-talk or thought reframing, which can enhance motivation, and we would also challenge their irrational beliefs, which can help to modify certain behaviors. Next, we have social learning. The social learning theory argues that behavior is learned through observation, imitation, and modeling. This learning model emphasizes the importance of using positive role models in social context to change behavior. To increase a desired change, I would use positive role models to demonstrate that desired change. To decrease the behavior, I would show the harmful effects on my patient and of others of that undesirable behavior. The psychodynamic theory argues that unconscious motives and emotions drive behavior. It also considers that childhood experiences also drive behavior. Using this theory, we would address unconscious fears and conflicts and promote behaviors that aligned with the specific desired change. To decrease undesirable behavior, we would use therapy to address repressed emotions and bring those to awareness, which could reduce their impact on the behavior. And finally, the humanist theory argues it focuses on an individual's needs, feelings about themselves, and personal growth. It considers intrinsic motivation to be the driver of change, unlike behaviorists, which considered behavior as a driver of change. To elicit a positive behavior change, this theory encourages behaviors aligned with personal goals and values, while providing unconditional support and creating a positive environment. This helps identify toxic behaviors that conflict with their authentic selves, and we would also replace them with value-driven actions. Next, we'll talk about how some of these theories can be combined to enhance learning and change behavior. So if we're combining, an example is the behaviors and cognitive theory. That combination teaches cognitive strategies and behavioral techniques and brings them together. So we'd reward patients. We would reward patients for changing their diet, offer them some reinforcement, and we would give them different meal choices if they felt like the meals contained within their diet were unacceptable or they couldn't do it. Next, we have the humanist and social learning theories. From a humanist lens, the behavior change occurs when we provide a supportive, non-judgmental environment, while we model behaviors that align with personal values, and this is consistent with the social learning theory. And another one more, we'll do psychodynamic and humanist. We will foster self-awareness and personal growth from a humanist lens while exploring unconscious drives. And finally, we are at the case scenarios. In the first case scenario, I'm just going to read it from the assignment. I'm a staff nurse, and I find that the nurse orientee I'm working with has difficulty understanding the idea of titrating drug doses on the basis of physiological data. A weakness in which type of learning might be underlying this problem, and in addressing the orientee's difficulty, what other information would I collect? Well, I've been there. I've dealt with that. For myself, I was the nurse that wasn't able to really understand how to titrate a drug. In this student's case, the weakness likely lies in their cognitive learning. In order to titrate a drug, the nurse has to possess a baseline knowledge of the drug, its onset, its effects on the patient, etc. This nurse, the student nurse, may have difficulty bridging the gap between their theoretical knowledge and their practical knowledge, or theoretical knowledge and practical application in real life scenarios. Additionally, I could also ask some questions to try to better understand what's going on with my student. One of the questions I would ask is if they're familiar with the drug. Another question is if they've ever titrated this drug before. And finally, another question I could ask is kind of what's going through their head as they have to think about titrating this drug. Maybe there's a mental block that we can help alleviate that'll help them move on to the knowledge that they do possess. Next, I'm preparing to counsel a student who's failing a nursing course. How would my approach differ if I base my counseling on self-efficacy or the attribution theory? Well, I've been that nurse that's been failing a course as well. I would apply the applying the self-efficacy theory to my patient. I'll need to know the theory, which refers to my students' beliefs that they can succeed in passing this course. My approach would be to boost my students' confidence and increase their belief in their ability to succeed in the course. I'll first identify areas of low confidence, use strategies from other theories like the behaviors theory, and provide positive reinforcement, and give my students small, easily attainable goals to boost their self-confidence. On the other hand, the attribution theory focuses on how my students will explain the cause of their poor school performance. My counseling will focus on understanding my students' perceptions of their failures and helping them take control of their lives, hopefully improving their performance in class. And finally, the last case scenario, I'm a clinical preceptor in a healthcare agency. How can I use a social cognitive theory to assist me in teaching my preceptee? So, learning by observation and interaction is the key to the social cognitive theory. Keeping that in mind, I would approach my instruction with my preceptee by demonstrating the clinical skills that I want, by modeling these clinical skills to them. I would have them observe, and I would use their observation and them watching me and us practicing and modeling these behaviors. I'd use that to help them adapt those behaviors to their nursing practice. That is all. Thank you very much.